pledge allegiance
to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you so much. We will get right into our agenda, and we will start with our roll. Stuart, please.
All right. President Wilson.
I am here.
Vice President McIntyre.
I am here. Good evening.
Treasurer Campbell-Voitel.
I am here.
Trustee Mazurek.
Here.
Trustee Meyer.
Here.
Trustee Prescott.
Hi, everyone. I'm here.
And Secretary Stewart. That's me. I'm here.
Excellent. Thank you so much. That brings us to the adoption of our agenda. Ms. McIntyre, our Vice President, please.
Okay, I'd like to bring forth motion 67 that the agenda be adopted as printed.
Support. So I have a motion properly presented by Ms. McIntyre and supported by Mr. Mazurek. Any discussion on our agenda? We've all seen it. All right, all those in favor?
Aye.
Any opposed? All right, the motion passes. And before we get into our consent resolutions, I'll tell you a little bit about what our agenda looks like tonight. It is primarily on the topic of health clinics, as you probably all know. There will be, once we get through our consent resolutions, as you'll see, we will have a few orders of business, and then we will have our first of two opportunities for public comment. That first opportunity for public comment comes before our dialogue and discussion and vote on our resolution. The second public comment opportunity will be toward the end of the meeting, and it will be after the vote. So I just want folks to know that that is what the agenda looks like, and that's what you can expect. So that takes us to our consent resolutions, and I'll hand it over to, again, Ms. McIntyre, please.
Okay, I'd like to bring forth motion 68 that the board accept the consent agenda items for approval as presented. This includes 5A, the minutes of the January 9th, 2024 Board of Education meeting.
Support.
So I have a motion properly presented by Ms. McIntyre and supported by Ms. Meyer. Any discussion on our consent resolutions? I had a chance to read our, I'm sorry, Ms.
We sound very similar.
That's okay, yeah.
I used to sit over there.
I think that's what it was, yep. So I have a motion again properly presented by Ms. McIntyre and supported by Dr. Campbell-Voitel. Any discussion here? I'll tell you that I reviewed the minutes and they looked okay to me.
Yep.
All right. So that brings us to our communications. Ms. Stewart, please.
All right. We've received communications, emails to the npsboe@northvilleschools.org.
Thank you so much.
And I'll say that there's a lot of them. I think we were getting multiple updates a day sometimes on feedback that people have written in. So just a comment, that members is we do get the emails, we do read them, right? So I just want everybody to know it's like it doesn't go into a black hole.
It does not. And if we even watch the spam folder in case something finds its way into the spam folder. So we are very diligent in keeping track.
All right, I appreciate that. That brings us to our superintendent's report. Do we have any?
Nope, I think a pretty robust night tonight. So
all right.
I'll put that in the hands of the board and the community. Thank you.
Well, that will bring us to our first of two opportunities for public comment tonight. This will be the opportunity before our resolution on our health clinics. Some ground rules here tonight. So we are here to conduct business. We are a government body that will be conducting district and state business. You are here to be present and participate to the extent that our public comment period allows. We are not going to be delayed tonight or interfered with tonight by any sort of jeering or applause, frankly, or yelling or questions from the audience. Your opportunity tonight, and I'm saying this because of last week and the experience that we all had, we are not going to entertain, accept, tolerate any noise from the audience. I'd ask you to respect that. You will have an opportunity. I'm providing you, and we are providing you an opportunity for 3 minutes. We'll be keeping track of that time. If you disrupt that, and we need to recess and get ourselves together and get our conduct and behavior together, that will be a problem. If it continues, we'll be forced to ask people to leave. Now, public comment. 3 minutes. I will be reading the names of cards of individuals who have offered their hand to give public comments. 3 minutes on the nose. As soon as you begin talking, we are going to start the timer. I would ask that you give a short name and connection to the district, right? You're a parent in the district, you're a community member, whatever it is. Give us your connection. That shouldn't take you too long, but we are starting the clock as soon as you speak. I'll say who's on deck, right? So the person, we have a decent number of cards tonight. I'll let you know who's on deck. But 3 minutes tonight, and I will start with the card on top here, Cheryl Phillips, please. And on deck is Janet Tian, just so you know.
I wasn't expecting to be first. I was the last one in the room. Sorry. I'm Cheryl Phillips. I have 2 teenage daughters in the district, and I am the Health Advisory Board co-chair. I wholly support this health clinic initiative. There is a reason Northville has become and remains one of the top school districts in the state. It is because when our seniors walk out that door every year, they walk out with all the skills: logic, language, discernment, decision-making, reasoning, rationalization, courage, grit, to do whatever they want to do when they leave, whether that is go to college, go to trade school, go to the military, take a year off, whatever it is they want to do. They succeed because we give them the resources to succeed. In our education system, when we are teaching, we have extremes of needs. On the one hand, we have IEPs, 504s, we need speech therapists, OTs, reading specialists, and now young fives, rock on. And on the other hand, we have honors, AP, IB, the tech center, dual enrollment, and early middle college. Nobody uses all of these resources. It's a small pot of students that use each and every one. But everybody who has a need has these services available so that they can become their best self. We work hard to help every student reach their fullest potential, to lift people up. And some should say we should stop there. We should stop at the education, but we can't because our kids need more. They need transportation, so we have busing. They need food, so we have cafeterias. They need connection and belonging and places where they are valued and supported and can thrive. So we have bands and orchestra and choirs and drama and art and photography and ceramics and clubs. Everything from houseplant and baking club to UN and DECA club. We also have dozens of sports. Each of these serve a small population of kids, and it fills them. It helps a need. It fills a need that they have. And it helps our whole population thrive and succeed. These health centers are another resource of support. It helps fill the gap for a group of students and families, giving them a resource, a support, helping them to thrive, helping them to succeed. It lifts them up. And when we can lift up any minority group in our district, in our community, it lifts all of us up. And that lifts our whole community up. So yes, while I understand that there are valid concerns that many of you will express tonight, and I have had myself as we were going through the discernment, I think we can work through those. I think we can address those, and I think we can move forward together. I encourage the board to help every student thrive in this community by offering this resource to them. Lift up our students. And most of these are the ones that need it the most because they're uninsured or underinsured, not as well as ones who are having mental health challenges. And when we lift them up, it's going to lift all of us up. And when we lift all of us up, we lift our community up. We need to address the concerns, but the concerns should not stop us from helping families in need. Thank you.
Thank you. And thank you for abiding by the 3-minute time limit. I will call to the podium Janet Tian, please. On deck is Therese Parasi.
Hi, my name is Janet Tian, and I'd like to formally reintroduce myself. Last week, I came to speak as a senior student at Northville High School about my own struggles and experiences and why I think this clinic is so important. This week, I return as the U of M Civil Rights Fellow representative for Northville at the U of M Civil Rights Academy in relation to the U of M School of Social Work, as well as a youth committee member at the Michigan Department of Civil Rights. With this established lens of a student in social justice, I intend to further back the proposed health clinic. Yesterday was MLK Day, and while working with my fellows at an event, I remember this quote from Dr. King. Of all the forms of inequality, injustice in health is the most shocking and inhuman. Health is a fundamental human right, and the Universal Declaration of Human Rights affirms that every human being has the right to the highest attainable standard of physical and mental health. In this context, we all have a right to accessible mental health advice, services, and safety. By not installing the clinic, we harm populations of individuals who do not have healthcare insurance. By looking around, the people in this room do not proportionally represent the entire district. But are we going to deny healthcare for hundreds of low-income students? You might not see them on the football field, in the band, or on the honor roll, but they still exist, and you should care. I trust the Northville board, and I admire your dedication to all parts of us, especially our safety. This proposal would further accessibility to health programs, breaking down barriers to safe, rightful care. Additionally, the idea of having a more qualified health professional on campus makes me feel safe. I know that in the event of an injury on campus, whether that be caused by a seizure or by a shooter, there is someone in close proximity who can administer life-saving medical care. There's also safety and confidentiality when it comes to healthcare. Socioeconomic status does not deter abuse or neglect, and we cannot forget that there are individuals in this district who fall into that category. Please look beyond your circumstance. I am grateful to the board for valuing and considering our student perspectives, but I am also frustrated because students should have a say in our future, and there is still a lingering belief in our lack of a fully developed frontal lobe, which would invalidate our judgment. And this action itself is ageist in nature and inappropriate in a setting which considers programs like this clinic that would primarily affect us. It should be noted that this concept also drives many arguments on the capacity of minors to give consent. To save time, I'm not going to get into the psych study of Johnson et al. 2009, which shows that there currently lacks empirical support for that statement and that claim. But even so, our pre-25-year-old brains do not indicate that our opinions in this case are any less important. So please hear us out. Everyone is here today because they care about and want the best for their children, and that is one of the things I love dearly about Northville. However, it is important to acknowledge that as adults, your ideas of what our schools look like, what we see, and what we need are different from reality. We, as the students, have that unique perspective, and I know we lack experience, but I also know that on a fundamental level, my peers have a right to the resources they need and the privacy that comes with such. Don't forget, we deserve grace and our autonomy too. That is why this opt-in function to this clinic, to me, is simple enough. If you're an adult and you are actually really concerned about the confidentiality for your child, please feel free to not opt in, but please don't limit this option for others in different circumstances. Don't take away this wonderful resource that will allow for even one child to get the adequate care they need. Finally, as a simple student who sees the abundant need, within our district
Thank you, Ms. Tian. Out of fairness, we're 3-minute time limit. Thank you so much. So I'll just remind folks, the timer is right here. You'll each have 3 minutes. And we are sticking to that tonight. I have a pile of cards here in fairness to everyone and giving everyone an opportunity to talk tonight. We are going to be holding to that 3 minutes very strictly tonight, as you just heard. Your time is right up here on the board and in several other places. I guess most notably for you at the podium, it'll be right here over our heads. Without further ado, I'll hand it over to Ms. Grassi, please.
Thank you. Good evening. Thank you for allowing comments from the public on this very important topic. My name is Therese Grassi. As was mentioned, my husband and I live in Northville, just a couple of very cold blocks away from here. And we have 3 children that are now adults that graduated from Northville Public Schools. We also happen to get our health care from Michigan Medicine at the University of Michigan, which is the only thing I really like about the University of Michigan, given that I'm a Spartan. I wholeheartedly support the putting medical clinics in our schools. The previous 2 speakers could not have summed up my thoughts on this issue any better than I could. So I will leave the details to what you've already heard. But our teens, as you know today, are under significant pressure. And I would welcome the opportunity for medical and psychological issues to be addressed in the school where they spend a significant amount of their time. If just one student is aided, and I'm sure it would be many more, then the presence of these facilities would be well worth it. I hope that the board will not be dissuaded by those who object to having these services available to our kids. Thank you.
Thank you so much, Ms. Grassi. I apologize for failing to announce who is on deck, but who is up right now is Mr. John Alvarez, please. And on deck is Amy Drummond, just so you know.
Minute and a half. Whenever I'm ready.
Go ahead, Mr. Alvarez. Thank you.
I believe Jim Gordon called a student a name and made him sit in his own poop. Imagine how that student must have felt. This memory will last the rest of that student's life. I reported this in writing when it happened, so you should have record of it. What type of disciplinary action did Jim Gordon get for stopping a student from finishing his business in the restroom? What type of memory are you going to give Tony Kowski and Jim Gordon for the rest of their lives for this horrible, horrible act? Thank you.
Thank you, Mr. Alvarez. I also want to, normally we don't engage in any sort of dialogue, but I do want to mention Mr. Alvarez publicly. Thank you for the respect that you've given us. I appreciate your willingness to work with us the last several weeks, so thank you for that. Up next, as I said, is Ms. Amy Drummond, and on deck will be Tammy Kane.
Okay, thank you.
Go
Good
ahead.
evening. My name is Amy Paravato Drummond. I am a clinical social worker. I've been a clinical social worker in the front lines for over 30 years. I am a parent of Northville Public School kids and a business owner currently. I am currently the clinical director of PCS Global, which is a mental health and wellness clinic that's been in Northville for close to 40 years. I stand before you here to shed the urgent matter that touches the heart of the educational community, and that is the escalating mental health challenges faced by our young students. The time has come to collectively address the issues with a comprehensive and multidisciplinary approach that includes establishing school-based health centers within our public schools. The mental health epidemic among our youth is reaching unprecedented levels. I do know that firsthand because I have worked in the field for many years. These mental health challenges impact their academic performance, social interactions, and overall well-being. As this crisis unfolds, we must recognize the need for a unified response beyond traditional and educational boundaries. I'm going to just give some key reasons why I believe that a multidisciplinary approach is incredibly important to be integrated. Accessibility and early intervention. This offers a convenient and accessible avenue for students to receive timely mental health services. Integrated care. These centers allow for integrating mental health services with primary care, ensuring a holistic approach for students' well-being. By combining physical and mental health services, we address the interconnected nature of their overall health. Early intervention is crucial in addressing mental health concerns and preventing them from escalating into more significant challenges. Additionally, this service offers a fast track to Michigan medicine, which we know is the leading healthcare, one of the leading healthcare businesses in the country. I worked there for several years, so I do know that firsthand. Collaboration with school professionals. These facilitate collaboration between mental health professionals and educators. This collaboration ensures a coordinated approach to support the students, combining educational mental health strategies for a more comprehensive response. Additionally, this addresses barriers to learning. Mental health challenges often act as significant barriers to learning. By providing on-site mental health services, we directly address these obstacles, creating an environment where students can focus on their academic success. And finally, the establishment of this type of center is part of a multidisciplinary approach. It is not just an investment in the student's physical and mental health, it's an investment in the future success and well-being of the community. Finally, by doing this, we're demonstrating our commitment to fostering a supportive and nurturing environment that empowers the youth to overcome the challenges they face. Thank you so much for your time.
Thank you. So Ms. Kane next, please, on deck. Brian, I'll probably mispronounce the name, but Friel. I just want to thank folks and our speakers for abiding by the time limits. I'll remind you again, it's right up on the clock is right over our heads. And I do want to also say thank you to the audience so far for being quiet. Again, we are not going to tolerate any sort of noise, yelling, clapping, anything like that tonight. So I appreciate that. Go ahead, Ms. Kane.
Tammy Kane, parent in the district. Communication. The lack of transparency regarding the proposal for these health clinics is astounding. It appears that Dr. Weber is driving these plans for the district with the board just following along. The board is supposed to be leading as Dr. Weber works for you, not the other way around. The first concern I have is regarding the communication on this, which has been atrocious. A survey was sent out that was very vague as to what the data would be used for, and now this data is being used to support the idea of a clinic. This data was collected under false pretenses. The public was only first introduced to this idea on December 5th, and here here we are 5 weeks later, and you all are being asked to approve this. The perception is this meeting is a check the box, as this decision has already been made. The public perception is that you are humoring us with this meeting tonight, as this is already a done deal. Consent. The point is we don't have a choice. A student can seek certain services without parental knowledge, taking healthcare responsibility away from their parents. I realize that's the law, but you can't vote until you're 18. You can't drink until you're 21, but you are inviting a clinic into our schools that allows very young children to make decisions without parental guidance. Convenience. More than one board member and a teacher last week talked about the convenience aspect, being able to have a boy or girl go down the hall and be swabbed for strep throat, for example. It is only convenient for the one school that has the clinic. U of M involvement. It is crystal clear that Dr. Weber and Mrs. Hoppenstedt did not investigate any other medical providers. We understand from some Novi School District parents that Dr. Weber has had a long personal relationship with U of M. Again, a rush to judgment. How do we know that Beaumont wouldn't provide us with better staffing and perhaps a licensed therapist? Safety and security. We spent a lot of time and effort making sure we restrict the people who come into the middle school and high school for obvious safety reasons. I, as a parent, cannot just walk into the high school. However, if I am a struggling or sick 19-year-old, I will be able to walk right on in. Why is this so urgent? We spent months seeking community input as to what a new Hillside Middle School would look like. This materially impacts our children, yet we spent 5 weeks, more than half of that was the Christmas holiday. What is the rush? What is the goal? Is the goal to get Mrs. Hoppenstedt a check mark to justify this newly created position that she's held for 3.5 months? Or is the goal to do what is best for our kids? This is more massive than Hillside, and there is no comparison as to how the two have been handled. Are you, as a board, accepting all of this as there is free money with a ticking clock attached to it? The board ultimately has no idea if the decision you are making is what the majority of the stakeholders even want. As always, thank you for your time.
Thank you, Ms. Kane. I'll call next, as promised, Brian Friel, I apologize. And then on deck, Steve Schaer.
Hello, my name is Brian Friel. I've been living in this community for 20 years, 3 kids in Northville Public Schools, 1 graduate and 2 currently in the high school. So, I'm going to take a kind of a contrarian viewpoint and just really offer a bunch of facts rather than, emotion. But so I think everybody needs to understand that these school-based health centers are nothing new. They've been in existence for over 30 years in our state. There's already 121 of these. You can find that on the Alliance website. Most importantly, they have a charter, a goal, a use case, what they're really structured for, and what problem they're trying to address. And whether you look at the School-Based Health Alliance or the National School-Based Center, right, at the national and state level, it's very clear. They're designed to serve the low-income communities where healthcare is hard to access. They're economically disadvantaged, and that's what these things do. They solve a problem. I don't think any one of the communications really addressed, like, what is the functionality? What are the purpose of things? What are these mission statements, right? So a lot of us don't even know what these are because we've never come across it before until now. I think it's important to also look at what the install base of these locations is. So here's what I remember, right? Where are they located? All the high schools, the school-based health centers. So we got Taylor, Romulus, Inkster, Detroit, Pontiac, Flint, Saginaw, Lansing, Benton Harbor, Muskegon, Battle Creek, Jackson, Kalamazoo, and Ypsilanti. U of M handles Flint Beecher, Kearsley, Carmen Ainsworth, and Ypsilanti Lincoln. And I wonder if anyone believes that we're comparable in the community as far as that. I know those are disadvantaged areas, and that's tragic, but that's not the model. You're trying to put this type of healthcare delivery model for low-income communities with a significant investment. You're rushing it through. 2 meetings in December, and then 1 on the college football playoff night. I don't think that's by coincidence at all, right?
Order.
But more importantly, I think this isn't a fit. And for U of M Health, I mean, they got a palace down the street on 7 Mile, and they've got 1 million patients visits per year. But apparently that's not enough for them. And that partnership's a little odd. So, I think it's incumbent upon the board to do 2 things: spend more time on due diligence, demand the reporting of each one of their sites, and provide it to the public. Because by state law, they have to provide all the detailed reporting of what's taking place as far as service delivery in every one of their locations. They're not more than important to us. Give that community and share it. I also think it's important to have a site visit. See what these things are all about. I think everybody should get their hands dirty on the board. Go spend a day at Kearsley's SBHC or Carmen Ainsworth. See how it operates. Ask questions. Talk about staff turnover before any of this is done. Thank you.
Thank you. That brings us to Steve Schaefer, and on deck, Mary Cullen.
Good evening. My name is Steve Schaefer. I am a 20-year resident of the Northville School District. I have two boys that graduated from Northville High School in 2015. They had great experiences in their time in the Northville schools. So I have a 16-year-old boy who's not in Northville schools. My 6-year-old son has mental health issues from birth. I've spent the last 10 plus years spending a lot of time learning how to be a parent of a child with those type of concerns. This is the first school board meeting I've ever been to, let alone spoke at one. I felt compelled to be here tonight to talk about this topic of introducing health clinics into our schools, especially as the information I've received in the meetings I've been at have really touted the mental health aspect of how these clinics are going to support our kids. As we know, post-COVID, that's been an exploding issue for our children. As a parent on the front line of what it's like to have a child with mental health concerns, the amount of work and coordination it requires from the therapist to the child, to family members, to siblings, to your coaches, to your teachers to create a successful outcome for a child is extremely significant and takes a lot of work and is a must-do to have a successful outcome for the child. To think that we can do that in a health clinic in a high school like Northville of 2,000 students with a single social worker who may or may not have the skill set required to help that child, I find extremely risky for the child and for the family, especially with the laws that we have that a child over 14 years of age can raise its hand, leave the class, walk into that health clinic and receive up to 4 months of mental health service from that social worker with no knowledge from the parents of that going on by law. I find that as a parent gravely concerning, and what the risk that could do from my personal experiences to the child and to the family. And I ask that you take that into serious consideration before you move forward with this decision. Everybody touts the good things that can happen out of everything that we propose. There's also is going to be risks. Thank you.
Thank you. As promised, Mary Cullen, and then on deck, Matt Wilk.
My name's Mary Cullen, and I've been a resident of Northville for a little over 30 years, and we had 4 kids go through the schools. And I know this isn't a time for questions, but I have a lot of questions because I was here last week, and I know that somebody mentioned that Supervisor Abbo did not know that anyone had gone in to find out about the zoning at the high school for a clinic, and I was wondering if that was looked into. I also had a question about one of the graphics that went up, and it was a bar graph that had the kids broken up into maybe 3 different age groups, maybe 4. The one that caught my attention, and I did talk to Melissa about it a little bit, was the K through 4. It seemed to me that all the other age groups, and this is, I think, maybe self-reporting of wellness or lack of wellness, the older groups seem to stay pretty even, the percentage of kids who self-reported not wellness. But the youngest group, the K through 4, doubled or tripled. And I'm wondering if that's being addressed, because it appears to me that everyone that's coming up and talking is talking about mental health and not physical health. And it looks like we've got a real problem with our kids in Northville that are in kindergarten through 4th grade. It was actually startling. Another question, and I know I'm doing all questions, but my concern is if we do get this clinic, U of M comes in, who's partnering with U of M? And I'll be blunt and upfront. I'm a little worried that maybe a group, perhaps like Planned Parenthood, might decide to put their literature in the clinic, or U of M might partner with a group such as that who has to do with the kids' sexual health. And I'm just a little bit worried about how far the U of M tentacles go and who's allowed in to this clinic in the future. Maybe the laws will be a certain way now, and then 3-4 years down the line, we have some meetings again, and it kind of goes under the radar, like a lot of people have been saying it has. And, the rules change. So, thank you. I appreciate you listening.
Thank you.
Can I make one comment?
Absolutely, yeah.
I just wanted to clarify really quickly the graph that she was talking about, because we did talk about it last week, was the risk assessment graph, just so we can clarify that.
All right, Matt Wilk on deck, as promised. Rick Angeland.
Thank you. I appreciate your time. You've seen me many times before, and I'll just summarize what you may hear and what you heard last week and sort of the unanswered questions that we have. First of all, last week we heard a lot of compelling stories from people, students, about mental health issues. But one thing that we have to keep clear is this is not a mental health clinic. This is a physical health clinic. If the Northville Public Schools wanted to create a mental wellness clinic, that would be a phenomenal idea. And I think that would have broad support of the community with targeted clinical counselors, clinical psychologists, and therapists. It's important to note that those people, their middle of the day is their lightest time because most of their clients are in school. Secondly, there's unanswered questions of building and student safety. Unfortunately, we've had a lot of conversations, at least in my time, about school shootings. 2 of the last 5, I think, school shootings were not students. They were recently graduated students who were under the age of 21 who returned to cause havoc. Those people would be let in if they had an appointment. There's serious unanswered financial questions. 31 AA, Sarah, your read, I think, was the same that I would be. It doesn't say building construction, so that's a potential issue. There's unanswered questions about cybersecurity and data. We talked about that a little bit last time. I think there was really insufficient effort to get this in front of parents. I guess I probably talked to 20 or 25 people, and the reaction to almost everyone was, "What? I didn't know about this." And that comes from parents. That comes from parents that were checked in. Additionally, there's no rush here. This was originally presented to you guys and to us because you guys say to us what you hear, that we had to do a rush because we had a grant that was going to expire. That doesn't appear to be a case, certainly or not with the high school. As I mentioned last time, it's kind of important to note that this is not something that our peer districts do. This is something that, as a previous speaker indicated, is really targeted towards those areas that have that need of uninsured or underinsured people and lack of medical resources. That Northville doesn't apply. And the 2 that looked at Grosse Pointe turned it down for reasons of student safety. And Oxford, and again, no one is more attuned to the problems of mental health than the parents of Oxford. I have a really good friend whose daughter's or son's girlfriend was one of the ones that was shot, and they think about it every single minute of every day, and they turned this down. It was because of that, the rules in around removing the parent from the process. I know it's not required, but it's possible, and they didn't really trust the district to fix it. So I appreciate your time. You've heard a lot. You'll hear a lot more, but thank you for your time.
Thank you. That brings us to Rick Angeland, and on deck, Michelle Boser.
Hi, I'm Rick Angeland, and I live in Northville. My 2 sons both went to Northville schools all the way from kindergarten through high school. They both graduated, and thank you, the board, and thank you, the teachers who did a great job, and I've always appreciated that. I've also been a resident and taxpayer in Northville for 38 years. So my comment is the whole thing was pushed onto us, or was not pushed, but it was discussed as a way to treat mental health. And I'm saying that, well, maybe we got the right problem, but we might have the wrong solution here. Last week, we had a teacher that came up here and was talking about the counselors at Northville High School. She said there were 9 counselors at Northville High School. They're vastly overworked. They can't meet the demand of all the students that need help. So to me, I looked at that and I said, well, geez, if that's the case, we should take a look at that and maybe hire more counselors. Is that what we need? But we came back and said, no, let's not hire counselors. Let's put a medical clinic into the building with not really any emphasis on mental health. So that kind of bothers me. Second thing I was going to discuss real quick is that I appreciate Michigan Medical. My wife and I both use some of their services. We go to some of the other hospital services too. I think the whole thing should have been done on a bid process. In other words, an open bid. They said, turn in all your proposals, Beaumont, Henry Ford, all of them. Turn your proposals in, and then we open them up in front of everybody, and then you choose the best one instead of just going right with Michigan Medical. So thank you so much for listening.
Thank you. Michelle Boschert on deck. Lori Suik, please.
Good evening, Michelle Boschert. I'm a resident for 26 years and a parent of a high schooler and elementary schooler. Mental health does hit my family. I waited 3 years prior to COVID, before any of the mental health things, to have my son evaluated for autism. A 3-year wait list just to be tested. Those 3 years went by without the needs being met for my child. Okay, so mental health gets me. On top of the autism, the anxiety, the ADHD, the disruptive mood dysregulation disorder, we have it all. Not to mention the food allergies. 504s are wonderful. So, that said, I feel, however, that what we're addressing here as a health clinic is not the same as the mental health that these kids need. And I see it in my elementary school son, who's not the one on the autism spectrum, that yes, they are depressed. COVID hit them hard. I mean, first grade Zoom, terrible. Had a fabulous first grade teacher, don't get me wrong. But there's a time and a place. And I don't like the fact that Michigan is here saying, we're going to provide doctors for you, but yet I've got a 3-year wait list to get my kid tested at the same facility, but they have extra doctors for us. It doesn't make sense to me. I feel that education should focus on education. If we feel there's a mental health need, yes, let's hire more social workers, more counselors for our school district. Because at the end of all of this, when we build a building and they provide doctors, but we still have to put electricity in it, we have to put plumbing in it, we have to pay custodians to be in it. That was part of the discussion last week. So we will be footing the bill for part of this. I feel that our money is better spent providing those services within the foundation of what we already have in the school district. Thank you very much.
Thank you. Lori Suik, please, and then Andrew Augustine.
Hi, thank you for the opportunity to speak tonight. My name is Lori Suik. I'm the mom of 2 children, one at Hillside and one at the high school. I was under the impression that the district understood the need for mental health assistance for our kids. That need has been found, and I hoped that it would be a major focus of the administration and of this board. The seriousness of this consideration of the outside medical clinic, not a mental health clinic, I'm going to say it again, medical clinic, not mental health clinic, has me questioning the district's priorities. My understanding is that there will be one social worker available to make referrals, and that seems like nothing more than a bandage on a much bigger problem. It also seems like a front for Michigan Medicine to expand its own interests by farming additional business from our district under the guise of mental health assistance. I'd like to see the district stay steadfast in the pursuit of mental health programming and resources in cooperation with actual psychologists and psychotherapists that are dedicated to our Northville students for this purpose and only this purpose. Isn't that exactly what our students are asking for? In addition to the lack of mental health focus The clinic also brings up concerns of building safety. Building security has been tightened at all of our schools. Additional resource officers have been hired. But now we're going to formally invite non-students into our buildings? This makes no sense. It goes against what we've been working toward. My son, who attends Hillside, walked into our kitchen while my husband and I were having a conversation about these clinics. And this is what he said to me. He said, wait, people are going to be coming into my school? That doesn't sound safe. So my 13-year-old gets it. He understands that there's a safety concern. This would make him feel less safe in his own school. How's that improving mental health? As a parent, I'm not allowed in any of these buildings unless I have business with my sons or unless I have business with the school. So we're going to open it up to strangers coming into our schools? That doesn't make any sense. So I'm asking you to vote no. Thank you.
Thank you. That brings us to Andrew Augustine, and on deck, Ron Picard.
Thank you. I'm Andrew Augustine, father of 2 kids at Silver Springs Elementary. First and foremost, I appreciate the time that you guys have put into this. However, I also empathize with you for being put into a ready, fire, aim situation that, frankly, you don't deserve. Nobody here is denying a need for additional mental health resources for our kids. However, this proposal is far from it. It's not hitting the desired target. There's no rush to implement this right now, right away. It's prudent to pump the brakes and take time to truly gauge what the community needs and how to best serve the kids and have the needs fit that objective and where it can be best located. If we want to have a true mental health resource center made more available to our kids, let's do it the right way. Let's add a true mental health wellness center in the schools. The health center won't achieve that. It's just taking an approach of saying, well, we did something, even though we're missing the mark. We have time on our side. Let's take the time, take a step back, take a deep breath, and really figure out a way to best get to the true mental health aspect of this situation. Thanks.
Thank you. That brings us to Ron Picard, followed by John Eloff, and that is the last card that I have. So if you'd like to make public comment, please bring your card up. Go ahead, Mr. Picard, please.
Hi, my name is Ron Picard. I'm a computer nerd by trade, but one of my older brothers is a psychiatrist and was a psychiatrist for decades for the VA. And there is absolutely nothing that good mental health care can make all the difference in the world. But bad mental health care can do more damage than anything else. And if you're taking a health clinic and then trying to make mental health out of it and putting one person in there, just selecting the right person for counseling. I mean, you can go through many people, and you do that as a process. When you're an adult, you can think about it, you can interview people. If you're a 14-year-old kid and you walk in and you've got one person to talk to, they may not be trained in whatever you're going through. There's just all sorts of reasons that is not going to work. And then if your 14-year-old has bad mental health care, all of a sudden they're going to be coming home and the parents are going to be wondering what's going on because there's a change in their kid and they have no idea why. So this is just not the way to do it. If there's a need there, that's one thing. But a lot of other people have said, this has been rushed too much. Take a step back. It's not worth the risk. I mean, there can be good that comes out of counseling and all that, but it should be done with the parent. Go out, talk to a bunch of different counselors, find somebody who is good for your child, not find out afterwards after the damage has been done. Thanks.
Thank you. That brings us John Eloff, and on deck is Janet Vander.
Hi, I'm John Eloff. I'm a parent here in the district of 2 kids.
I guess I didn't see the other meetings before, so I'm a little bit behind. But I guess what I'm trying to figure out is what problem are you actually trying to solve here, right? Are we trying to solve a mental health problem? Are we trying to solve a physical problem? Are we trying to make sure uninsured kids are taken care of? Because I'm not real clear as to what's going on. Because it seems like we have a clinic that wants to come into the school, and now we're finding ways to justify that outcome. And it doesn't feel like we're saying we have a problem we need to address, and this is how we're going to address it. Okay, so do we have kids that are not getting physical care that they need right now? Are there kids, is there a flood of kids coming into the office with broken bones and everything else that aren't being taken care of? I mean, this is talking about things that are for low-income kids, right? The money that's going to come to Northville schools, one of the most affluent schools in Metro Detroit, is going to be used here in a place where the poverty level is 3.4%, and according to the census, 1.4% of people in this community are uninsured. So you're talking about, of 7,000 kids, about 70 that would be impacted if that's spread out. Your clinics are going to end up in Hillside versus Meads Mill. And Meads Mill has the lower socioeconomic kids. But we're going to move the thing to the more affluent side of town. So I don't think it's about health care and health insurance. When we're talking about mental health, if you're going to have a nurse practitioner and you're going to have a PA and you're going to have a social worker, how is that going to help mental health? Are these going to be psych nurses? Are there going to be psychologists or psych trained physicians or physician's assistants? And is 1, 2, and 3 people going to solve the problem that we have? I mean, if we have social workers and we have counselors, 9 of them aren't enough. Is bringing 3 more people going to solve that problem? Okay, so I guess I'm not really understanding how all this works and how it all makes sense. Okay, the other thing is, it's not for the school either, it's for the community. So it's for the entire district. Why does it need to be in a school then? Can it be in this building? Could it be in another building someplace else? I mean, if you have to build something, everything has to be HIPAA compliant. So everybody that walks in has to be taken care of for privacy and protection reasons. Do we have that? Is the school going to be able to access these kids' records? And is our school HIPAA compliant with that? Is data going to go back and forth between the two things? There's so many variables and so many problems. I just don't feel like I know enough to answer either affirmative or negative, because it feels like we're a little too murky to make that decision right now. Thank you.
Thank you. That brings Janet Vander. I'm probably not pronouncing that correctly.
You're close.
On deck, okay. On deck, Christa McKenzie.
Hi, everybody. Janet Vanderlucht. I live just down the road. I have 3 children in the district. Well, actually 2 just graduated. They're in college now. I have 1 at Hillside. I don't think I need 3 minutes. I just want to put my hand up and say, you guys, what are we doing? I don't know how you could possibly vote on something with this many unanswered questions. Where is your due diligence? Come on. I don't know any professional who would vote on something in a positive way and go home feeling good that I just voted yes on something that nobody understands. We don't understand the problem statement. I saw somewhere in the very small amount of information about this, 4 slides maybe, 8% of people are underserved. Okay, great. Is that the problem statement, or is the problem statement mental health? I'm not sure which one we're going after here, but it's very confusing, and you can hear it's very confusing. So that's really all I need to say is, what are we doing here? What are we voting on? Come on, you guys. There's simple stuff out there. Why are we not talking about cell phones in school? Get the cell phones out of the middle school. Come on. This is so simple. Plymouth did it a long time ago. Get the cell phones out. Mental health will improve immediately for middle schoolers.
Okay.
Work on physical education, work on diet, work on things that are actually going to be easy to do, and you don't have to spend all of this time answering all these questions. What are we doing? What is the problem? That's all I wanted to say. Thank you for your time.
Thank you. Christa McKenzie, followed by Ron Frasier.
Hello, I'm Christa McKenzie. I have 3 kids in the district. One of them attends Hillside. So I agree with a lot of what everybody is saying here tonight about
the confusing nature of this, the rushed nature of this, and basically how as a community we feel like we've been excluded and left out from this conversation. It's a little confusing as to why nobody was included earlier than December, when clearly it, was something that was being worked on since October 1st. So that's 2 months where that would have been good time to, clue in the community to get some input and decide if this was actually something that everyone was interested in, and also give us more time to do our own research. So I still really don't understand why that wait time happened. And then, like I said, last week, it was over the Christmas break, so a lot of people were a bit distracted. I'm going to talk a little bit about the 31 AA fund, because I'm not sure if everyone is fully aware that the 31 AA funds presented as light construction money to build out this clinic is actually a part of a much bigger fund that goes towards solutions on mental health. At $200 per student, it's actually over $1.4 million. Correct me if I'm wrong. This is a one-time fund to go toward mental health and safety. At least 50% of that must be allocated to mental health. The other 50% could be mental health or safety measures. This was just applied for in December, so I'm not sure how much of it has already been allocated, but it needs to be made more clear that this is a completely separate fund and a complete separate opportunity than the health clinic. I feel like they've been kind of presented together, and that's very confusing. But that's $1.4 million. That's totally separate. What could we do with that? At a minimum, $700,000 must be spent on mental health. The only discussion regarding utilizing this money is using it for drywall, sinks, and restrooms. This is a one-time fund. I'm not certain if there's another guarantee on this. That was one of the concerns for the clinic. Are we going to lose a good opportunity? Are we going to lose a good opportunity with that money by spending it on drywall? I wanted to approach another thing that, I'm hearing a lot of people say, like, if you don't like it, don't have your kids go, don't use it if you don't like it. And this is a better than nothing, at least we're doing something kind of mentality that I've been getting. And
Thank you, Ms. McKendles. That brings us to Ron Frazier. That is the last card that I have here.
Hi, I'm Ron Frazier. I have a 5th grader at Winchester and an 8th grader at Meads Mill. Last week, we heard from an array of compelling speakers about their insights into the many benefits of establishing these health clinics. We heard from current and former students that bravely shared their mental health challenges. We heard from a school counselor who spoke about how children crumble while their families try to navigate health insurance coverage for mental health. We heard from a Hillside teacher who shared their experiences talking about how mental health struggles manifest themselves into physical symptoms. And we heard a counselor from the high school who talked about how children suppress their mental health concerns because they don't want to burden or disappoint their parents. Today, I'd like to talk about a few of the reasons we've heard why this opportunity should not be pursued. One of the common recurring concerns that we've heard mentioned last week and again today is about the Grosse Pointe schools and their attempt to establish a similar health clinic with Beaumont. I do agree that a closer look at the details of the Grosse Pointe project reveals some concerning aspects. They initially budgeted $700,000 for the project, and that ballooned to nearly $1 million. And that was, they did not have a grant for that, so that came purely out of their sinking fund. When the project ballooned, they, due to the district's financial challenges, including plummeting enrollment and half-empty schools, the board voted to halt, not cancel. I watched the board meeting. They did not cancel it. They halted it until they could find an alternative source of funding. Unfortunately, their inability to secure that funding before the grant's deadline expired resulted in them not having the clinics and losing the grant to a loss of $300,000 per year from the grant funding. Comparing that to this Grosse Pointe situation to what we're doing here in Northville, this Northville proposal stands out as an exemplary model for addressing this matter. No funds are allocated from our general or sinking fund. Instead, all the financial backing comes from the 31AA grant, and our partner has committed to covering any expenses exceeding the allocated amount. This well-structured proposal reflects careful planning, and I commend the administration for presenting our board with such a well-thought-out deal. Another topic I heard discussed was a fear that there may be some liability incurred by the school because of this. I do think it's a valid concern to make sure that we are protected. That said, for my part, I spent a good deal of time researching for articles on the topic, and I couldn't seem to find anything much about schools having been sued over one of these clinics. Considering these schools have been in operation for decades and MDHHS operates 121 of these centers across Michigan, I think the absence of information on this topic tells me a good deal about the answer. But I'm still in favor of asking for more details on the topic if we haven't already. However, I don't see any reason to stall the process while we wait for those answers. At this point, my understanding is that we are not voting to build the center. We're merely voting to apply for the grant. The grant won't be announced until March, so that's 2 more months. We have to keep working out details. I encourage you all to vote yes tonight. Let's initiate the pursuit of this grant while trusting our administration to further refine the details in the exceptional manner they consistently demonstrate. Thank you for your time.
Thank you, Mr. Frasier. That is the last card that I have. Public comment closes in 1, 2. Thank you so much. I appreciate the audience for being super cooperative and respectful to all of our speakers. I really do appreciate that. Really, hats off for that. That brings us to number 9 on our agenda and our resolutions in support of a child and adolescent healthcare clinic. And I will hand it over to Ms. McIntyre, our Vice President, please.
Okay, I'd like to bring forth motion 69 that the Board of Education adopt the resolutions in support of child and adolescent health clinics in Northville Public Schools as presented. Support.
All right, so I have a motion properly presented by Ms. McIntyre and supported by Dr. Campbell-Voitel. Let's open it up, board, to discussion, thoughts about this, questions that we might have. We are voting on this in T-minus minutes. What I have my thoughts on where I am and my why after thinking a lot about this, but what do other folks think?
I have a question real fast to the finance subcommittee that met beforehand regarding the topic of the 31AA monies being able to be used for the infrastructure costs surrounding the clinics themselves.
So we looked at, three of us were in that sub-meeting. I'll explain. I don't have the actual budget in front of me, but we did have confirmation that there was a personal contact with the grant administrator for the 31AA funds that provided us with a verbal confirmation that we could use the funds in this manner.
Yeah, but Kim, I mean, I asked the question, right?
Yes,
$220 per student, 1.55 million, 50% of it has to be used. And when I asked Mike, what do we got? It's like, well, we had a verbal conversation with someone who said, yeah, it'll work, right? Mm-hmm. But the answer is, if you read the actual details of 31A, it's 3 line items. Not one of them talks about construction or facilities. It's about people, or it's implied people, right? You know, now I love our government, but I'll be honest, I don't trust our government worth a dime. And if we go off and spend the money and this person doesn't deliver on it, we'll get audited. And guess what? That 31AA money has to go back to them. And now that money comes from our general fund. So I hear it, and I challenged Mike and I challenged Darby. I said, listen, it's a nice statement that you verbally talk to someone. Unless you get it in writing, it doesn't count for me. Mike made a statement. We were talking about applying for a grant for electric buses, right? And the government said, we've had too many issues in the past. You can't just apply for the grant. We want an official signed statement from a board member. How is that different from my question to them, right? You know, so the answer was, Kim, you have to sign up for this thing as a board representative. I don't trust our government. I don't trust the verbal, especially when the line items do not clearly say anything about construction. Now, maybe at the end of the day, this person's going to sign on blood and the government gives it to us. I don't know. But in due diligence, I can't sign up for $400,000 for one school potentially 400,000 for another, and maybe another 400,000 for a third school, right? I don't know the timing of it. So that's the comment that's out there, is we don't actually know. And if you look at, I mean, let's face it, our government, they're very good about, it's only what's written on the lines. If it doesn't say it, it's not implied. So that's what we talked about, and those are the facts there.
So I guess in my mind, what we're talking about here tonight is to throw our hat in the ring. We're just making the decision to compete for a grant. And in the meantime, that, you know, we have time to maybe get that person to put their name on a list, on a line. I have got to believe that the people in the district that had the conversation and our very reliable finance and business managers who were on the line to hear that, you know, can follow up and ask for something in writing. But right now, tonight, all we're making the decision to do is throw our hat in the ring. And then we have 2 months to work on details.
So I'll add this. I mean, in the area of law that I practice in, I mean, you have law, you have the Constitution, you have amendments, you have bills of rights, you have state laws, you have all the way down to informal opinions on things and verbal commitments and statements from regulators and that sort of thing. So in my mind, I get sort of the concern, but I do have to say the body, you know, the law works around a whole host of things. That's not just, you know, blood statements signed in ink. There's a whole host of things that govern how these sorts of funds and the law works in these kinds of areas, especially when you're getting down into details and gray areas that could not possibly be covered by statutory language that predicts where every dime will be spent. That's just my take on that question.
I wasn't here last week, unfortunately. I wasn't here, so if you'll humor me, you know I'm a verbose person, so I'm going to say it anyways. But I'd like to start off and kind of share some thoughts, right? Been a member of this board for 12 years. I want to say 2 words. I'm going to say it 3 times. The process, the process, the process. How did we get to be one of the top districts in the state of Michigan, right? It's because we deep dive everything. We do a lot of due diligence. We do a lot of long studies. We have strong community input, and we do lots of dialogue. Some of the dialogue gets ugly. God, there's been lots of board meetings where we have debated and argued and that. Sometimes people say, Jim, did you get along with your board members? Honestly, I get along with all our board members. The fact that we dialogue and we have difference of opinion, that's why we're better, right? It's because we share that back and forth, right? The process takes longer, and it can get messy. But it builds strong community input, and at the end of the day, typically leads to the right answer. When you do things willy-nilly or short the process, you take lots of risks. We got here today because over the last 12 years, we were diligent to the process, right? And, you know, you guys have seen stuff, but that's really important. It's how we got there. It's part of the magic secret sauce of why Northville is what it is. My next statement is kind of like, and I heard it here, a lot of it, but I had written it down before that. What exactly is the problem we want to solve? Because I've heard it gone both ways. When we started out in December 2nd, it was a medical clinic, right? And we talked a lot about convenience. Okay, I get that. There's convenience in that. And then we kind of shifted it to mental health. Personally, I do kind of agree that mental health is an issue. And it's probably way bigger than a medical clinic that we could put in. And honestly, we are such an affluent community, we can afford to go to the doctors. It is not an issue for our community. But the mental health is an issue, right? Why is it an issue? Well, we believed our government who said, 6 foot distance and masking.
And we had a lot of debates about that one. And I bought into it. We did what we did because the government said that was the right answer. Until something happened like a week ago or 10 days ago where Fauci basically said, he goes, well, yeah, the 6 foot just kind of came about. There really wasn't science behind it. And the masks, well, yeah, it's true that the molecular size of the COVID was way smaller and masks didn't help it, right? So I'm like, okay, why do we have so much mental health? Is we isolated our kids. We took them out of school. We took them out of situations. I don't blame anybody on this board. We reacted. We did the best we could given the situations. But at the end of the day, look at it now and go, hell, we created the problem by not following a process, by allowing people to ram through an opinion without letting anybody second guess it. Okay? If we wanted to say focus on mental health, I actually heard a lot of people here say that's the right thing to do. I actually support that. I think that's a great idea. But let's focus on a pure mental health piece of it. We've got, I don't know, Mike will tell you the real number. We've got $28 or $30 million in our fund balance, right? What would it take to dedicate 2-3 people? And maybe we could use part of this 31A, which is allowed to be used for people, right, to pay for the first 2 years of this. And if it's successful, then as a community, I don't think you guys would mind us using part of our money to continue paying for that. I am concerned about some of the details. Some of the costs are unknown. I mean, Lindsay, I get it, right? If you think I mistrust Mike, you got another thing coming. Mike is the most stable finance person out there. I would trust him with my life. He's that good. It's not that I don't trust Mike. I don't trust our government because they've been proven to not be honest with us or tell us something that, well, I think it's going to go this way, and then at the same time it's not. Michigan medicine, this is really interesting to me. We're applying for a grant from the state of Michigan, which if we get it, will be ongoing and help us build a medical facility, not a health clinic. But the only reason they could do it is if they put it in Hillside because it had to be outside of Wayne County. Couldn't get it if it was in Wayne County. And I went, wow, that, when Michigan Medicine talked to us about a week later after December 5th, I can't remember the date, we were at all at Ammerman, they kind of said, really, what you really should do is put it in your largest population center. Quote unquote, coming from the Michigan Medicine guy, Northville High School would be the place to be. Okay? Magically, when we challenge that, Michigan Medicine says, I'm going to give you $2 million. Now, nobody gives you $2 million like that. You need to ask, why are they so interested in giving us $2 million? Right? They see a value in it. There's something in it for them. I don't know what's in it for them, to be very honest, but I'll tell you what, when a person stands up and says $2 million, they're doing it for a reason. And, Lindsay, and I appreciate your comment you said last week, because I actually watched the video of when I wasn't here, the whole thing. It was messy, it was a little bit ugly, but I thought it was a valuable lesson. But I think one of your closing comments was, we have an opportunity and we can't wait. We got to go do it now. I come from the Warren Buffett School of Investment, right? You invest long-term, you do a lot of due diligence, and after a lot of time, if you invest, you win, right? My wife's here, she's watching, she knows we talk to financial advisors, and the first financial advisor comes in and says, Jim, you got to go do this now, you got to sign next week. It's like, see you later, alligator. Because if it's really a good decision, it'll be there next week. If this is the right decision for our community, and Michigan Medicine's willing to throw $2 million in their pocket, they'll be here, right? They see some value. I don't honestly know what the value is, but they see something, right? There's a lot of repeated stuff that I heard, so I'm not going to repeat the stuff that came from the community members, because I I get the gross point. They did it for financial reasons. I understand that. They don't have a 30% fund balance like we do, and they can't afford to go do this thing. We're in a different situation. Thank God we're in that different situation. Oxford is the one that's kind of interesting, right? I don't know who said it, but someone talked about Oxford. If there's a community that's a high-end district and could use mental health, they turned it down. And I think they turned it down not so much, I think they turned it down for the same thing we're talking about here. Do they really need a medical center, or is a mental health clinic more the focus? I actually would like to see us focus on the mental health piece. If Michigan Medicine truthfully believes that this is the right answer, they'll invest with us, and let's go off and do it. Let's use the 31A. Let's propose to use some of our fund balance. And the last thing I'll say is, public, you guys write some freaking great letters. There is some incredibly intelligent information that was placed to us, and there was a lot of them. Unfortunately, I did my normal thing. I printed stuff out on the computer, and then I had to be here. We had a 4:30. We had a meeting before this finance committee, and before that we had the district curriculum council, and of course I left the print sitting at the printer. But there's a parent who wrote in with a medical background, and I don't know this person at all, and I'm going to butcher the name, but I'm going to do it justice because I give this person a lot of credit. Vidushi Maru, and wrote this letter that actually said she supported the idea of it, but then went into, because she's in the, actually it could be a he, I don't know if it's he or she.
It's a she.
It's a she, okay. Went into a bunch of just details about Michigan medicine and questioning about how it's going to work and everything else. And I'm like, wow, this person really knows what the hell they're talking about. And I would like to do the due diligence and bring a person like that in and really get into it. So, I appreciate all the information. I appreciate Dr. Weber, who, he is he's not weak at heart, right? When
last week.
No, but I mean, when he believes in something,
I've never been approached like that at a meeting last week, and my commitment is very much to the kids of this community, to each of you, and I agree with you in saying, like, we can agree to disagree on things.
Mm-hmm.
Tonight, I think, was a very different night where people came and spoke their truth in a way that engendered people listening to each other rather than going past each other. So I just want to say thank you for bringing those things up.
I mean, RJ comes from his heart. I mean, listen, it's not tough to figure out where I am. You can read me on my sleeve from 10,000 miles away, right? At the end of the day, I think we're driving this process way too fast. I think we will get the right answer. We as a district are really smart. We have the financials. We have a really good team, and we can get there. I don't think we need to make a decision today. And I think that the right answer is probably not a medical clinic. It's something else. And I think if we devote the time to it, we can actually have something even better. We've proven our district is different. And the reason we succeed is because we're different, because we approach things differently. We approach things from the long term. And we do the due diligence and we argue. Yeah, we do. But those arguments tend to find, I love Sarah. We have different opinions on things, but you know what? Every time I listen to Sarah talk, I go, you know what? Good point. I didn't think of that. And so, it's like, okay, that my vector arrow, because I'm an engineer, right? We got to bring that, moved over a little bit. I listen to someone else and like, yeah, that's a good point. And you know what? We go back and forth. And at the end of the day, she may have been here, or I may have been here. And we came to a solution that was generically better for all. And that's why having a board with different opinions and different thoughts gets you to the right answer. And that's why the process is important. I'm going to shut up now. I'm not in favor of this at this moment in time. I am in favor of the healthcare clinic. I just don't think we figured out the right answer today.
Thanks, Jim. Yeah. Anybody, who else? Comments? Things they want to air?
Can I talk to some things that the audience raised?
Absolutely,
One
yeah.
thing that I thought was more this week than last week, so I have pages of notes, pages of your emails marked up, and sticky notes on them. But one thing that I noticed is thematically tonight, and it's not going to be as directed as your comments were, but it was, I wrote some comments like, there's simple stuff to go after, is 3 more people going to solve the problem? Let's not hire counselors, let's do a clinic. Not sure what problem we're trying to solve, and is it problem driven? But that was my summary. Whatever else happens here tonight, it's really, I think, one theme that I didn't think was, we would leave here in good stead. If we didn't say, mostly it's nobody in that room. So those of you who have come to a number of meetings know you're usually 1 or 2 people. And a lot has been done for years on mental health in this district. And in the last 5 years or 2 years or whatever number you want to take. And a lot is being done around safety because of the issues that mental health raise. And I don't want to sit here, I couldn't even do it. Like, it's not even possible. I thought about trying to jot notes, but like 3 SROs, I don't think there's any school district anywhere that has 3 SROs. And like, that was a fight. I mean, we were like, it was in a closed session about security. And I mean, believe me, there was a lot. We've hired counselors, like a lot lately. We've gotten technological fixes to remove the workload from the 9 who are so overworked. And like, we've invested in that. I mean, I could go, like, this is not a problem that anybody here, no matter what their vote is or isn't, is going to be like, well, that was the problem. That was our solution for that, because I just couldn't even list off the number of people. I mean, we have a new hire, and so on. So I just think, and the 31A money is over $1 million. I think it's 1.4-ish. I think that's about back of the envelope what I get. A big number of that has been spent on security, or is earmarked for security. And we've had closed sessions about what the security is and what the dollars are for. We don't always like bring that out and trot that out, because then those measures might be able to be better thwarted, right? Like, you can go around the measures if every Tom, Dick, and Harry knows about them, and the Open Meetings Act allows you to focus that in a closed session. So I just want to say, like, there is no way this clinic is a solution, period. That's the end. And it also isn't the beginning. And it's not even the middle, or, I mean, I think that just is something that maybe we could do a better job of communicating, or maybe, that like lists could be made, or we could have open, town halls so that people are invited in. Because one thing for my fellow board members, I think we can all agree on is, weren't you interested in how unified the public was? They see this as a problem. Mm-hmm. Yes or no speakers were like, yeah, this is something I'd like to work on more, or I'd like to hear more about, or I'd be willing to spend more money on, or maybe we should focus only on this. Mm-hmm. And I find that very compelling, because sometimes it's hard to know. And then another quick thing is just, we do a lot on budgets. And Matt, you taught me this. You sat here and taught me about structural budget deficits and spending grant money on one-time purchases. And you're pointing back to Mike, because Mike and, it's all web. But the bottom line is, when you have a one-time grant and you build an ongoing clinic or hire 6 more people, and Jim, all of them who've been treasurers, I'm always the one who's like, let's spend more money and hire more teachers. We need smaller classrooms. And you all tell me no. And you all tell me we're going to crater. And Matt would say the airplane is landing into the ground. Like, Jim, how many times do we hear it? So, I just want to say, one of the problems here is that we have one-time money to spend on a freaking huge problem that we don't control, and we're trying to find ways to spend it, and we're spending lots of money on other things. And you're right, it's not a solution that's going to end teen suicide. And I'm sorry, but teen suicide did not start with masking kids. I've lost 3 kids at least that I know of while I've been on this board, and 2 of them were before COVID. And so I don't agree that the problem, and I do agree with, let's get rid of the cell phones. I'd do it right now. I would vote that right now. And I agree with diet. And I agree with so many other things. And I don't think this is the end of a conversation, no matter what happens, about those good ideas. And I would personally like to spend my years, whatever they are remaining on this board, or months, or whatever it's going to ever be, talking about those things, because those things are urgent. And they're just as urgent as this. It's just that this is a pot of money. Anyway, those were some of my thoughts about the public comment.
Ms. Prisca, I completely agree with you, and I agree with a lot of things that Mr. Mazurek has said as well. And I don't know if I'm harping on one small detail, the sticking point, but I do have to really agree with Mr. Mazurek in terms of, is there any way that we can get some confirmation about this 31AA money? That does make me feel a bit uneasy, because I know as you're talking about how this district has a history of being so financially responsible, and the idea that we're going to put ourselves out there and not be supported, that does concern me. Is there any language or anything that we can do to get some more information or something more secure than a verbal confirmation from someone who wasn't directly asked regarding, was it directly asked?
Oh, yeah.
It was direct. Us, Northville. It wasn't just like, can this funds be used, but we put this grant in.
It has to be for something new, right? It has to be new expenditures.
It can't supplant. You know, I guess and Jim raised this, and I think this is, I'm a lawyer, and Lindsay's already cited his lawyer. Part of the public's concern, I completely agree with, and I think it's a little different when you're on that side, because you don't get to quality control what's the next step, and is it a slippery slope, and are you really going to do a good job implementing it? Those are all legitimate questions, and we owe that accountability. I sit here and go, I'll be damned if I'm going to let us walk through this without that MOU, saying some very specific things. And if you have ever sat through any board meeting with any contract with me, I go to the other extreme where they're all like, you're in the weeds, you're doing too much, you're too specific, right? It's not going to happen without me having a gigantic verbal, physical, everybody's going to know it. I know that, you don't. You just have to trust. And so I get why that's different. So I sit here and I go, there will be an MOU, and it will say $400,000 cap. And it will say that we're not committed beyond what the parameters were that were presented here. And we will address that your staff is responsible for being with people. And we will address, where the liabilities are and where the liabilities aren't. And we will address if 31A falls through. In my opinion, that's the premise that this vote is based on, is that there's a particular line item of number, that there's an edge, that's enforceable by contract, and if it doesn't come through, I'm sorry, but that wasn't the program.
Mm-hmm.
So but now I'll get on the soapbox that Jim was on, which is, that's asking you all to trust us. And if you were here a week ago, you know that my point was, I think we could have done better at doing this sooner and earlier, more and more often. And it's a shame if you walk out of here thinking that I'm somebody's rubber stamp, or that anybody's a rubber stamp. And it's a shame if you walk out of here thinking this was a backroom deal that was already fixed and done. I don't want people to think that. I get why people might think that. That's not what I'm about. But it happened in December. It could have happened in October. I've addressed that publicly. I've addressed it privately. And I do think I've been heard on that. I don't think these people are a rubber stamp. And I think that what it looks like a rubber stamp is because we're getting feedback that, you've done all this work ahead of time, you're obviously going to just do it. You had architects in to look, and you have a budget for this, and you have, all these details, and people visited clinics. Obviously you're going to do this, or they hired Darby, or, all these things. But we're also getting feedback that we don't have enough due diligence. So it's like the more due diligence so that we can give you more answers, the more it looks like the fix is in. So it's just, I feel a little bit of that tension on that, and I don't know how to answer that. I don't know if you guys are feeling that.
I feel that.
Yeah.
I wanted to address the mental health clinic piece because as a practitioner, I know this is not a new crisis, right? This has been growing, this has been building. Many of us have watched it in our own families, we've watched it in our neighbors. I was first licensed in '97, so this is not a new problem. The approach is sometimes different. Did things get accelerated with changes in our world? I would hesitate to say, I'm not going to hesitate to say, yes, I think that did happen. I think we're in an unfortunate situation where there have been some clinics that were funded by the state for mental health services. They called them E3 clinics. And they focused on some of the things that we've talked about. This would be beautiful if we could pluck money out of the sky and get psychologists and psychiatrists, perhaps, licensed social workers who provide therapy. You could do counselors, you could do all these things. The state was funding some clinics. And they have decided they are not funding those clinics anymore. They are not funding new clinics. They will continue to fund the ones that are in existence. Okemos High School has one on their campus.
Pioneer has one.
Pioneer has one. There may be other schools. The Okemos Clinic is funded by MDHHS. That one stood out to me. I really see it as a layer. It is not the solution. Right? As a mental health practitioner, to have access to a pediatrician who can talk with the parent about some of the health issues that a client is having, to have that opportunity to connect with those providers, or a nurse practitioner who can give me kind of that medical perspective as a practicing therapist, that is the kind of linked services that do support kids the best way possible, rather than having to call, as a therapist, a pediatrician. I've got my consent form signed. I've got my release of information. To have all of that, it's one layer. It's three people. It's the opportunity to tap into the families who are connected to the kids and meet the families where they're at, provide that support. It's a layer. It's a start. I definitely hear what people are saying, and I agree that three people are not going to solve this problem. I also think the opportunity to partner with a group who has 30 years of experience of doing this as a school-based health center, as that alliance, that partnership, can give us a launching pad for what else could we do that would be interesting and different. And there's no non-compete. Michigan is not coming in saying, we are the only people that you can work with. We have plenty of other relationships. We have a beautiful MOU with Schaer Health for our emergency crisis intervention evaluation process. We are really connected with the Northville Youth Network and all of those services. None of those things are going to change. I think it's an opportunity to get some support outside of our district, that we don't have to have all of the solutions for the answers. We have some people that have been doing this really well for a lot of years. So let's get some of their expertise and teach us how do we move forward with the next level of our problem solving that we're all agreeing is a problem.
So I kind of like that I waited a little bit to talk, because so many of the things that I wrote down have already been covered. So I have been on the HR policy committee for the last year. And it's been an eye-opening experience to learn from Sarah how diligent our team is on policies and procedures and making sure that we are well within the law. And so, I think one of the things that we as a board are going to be responsible for is making sure that these, all of the community concerns about parental notification and parental consent and the minor consent laws, that we make sure as a district that we put policies in place, that we put procedures in place and guidelines that are clear and follow all the laws. And luckily we have Rebecca Peck, who is very on top of all of this. And that we make sure that all of those are well documented. And then that we make sure that they're communicated not only to the staff in the buildings, but also to the community. So, yeah.
Just to, I think, make a comment that coordinates with what you were just saying, Melissa, is that we're at a letter of support, or we're voting on the concept. We're throwing our hat into the ring. The next step is that level of detail that you just talked about. It's fleshing out the working rules, the work rules for the relationship between the district and Michigan Med, and as well as the obligations that we have with our existing partners. And you talked about NYN, Northville Youth Network, Hagera. We have many layers of resources that we have brought to bear because we have worked really hard, as Sarah pointed out, on meeting the mental health care needs of our kids. So all of those relationships, those intricate relationships, those operating rules, that whole process of accountability to each other, defining the role for Michigan Med as a gap filler, not as a competition against our existing relationships. They, in fact, in their MOU template, specifically say that they are being held accountable for a non-compete, to work within the existing processes and practices that have been put together in this district. And so all of that is yet to come. We're just not there yet, but that will come. And I agree with you completely. We are a district that dots the I's, crosses the T's, and we will get everybody at the table. To speak to the fact that there is an advisory board with all of the constituents who have skin in the game represented at the advisory board. And it might be our health advisory board as it exists, but it might be that needs to be tweaked a little bit. I don't know what the requirements of the grant for the composition of the advisory board, but the state is very specific what they hold us accountable for in terms of the proportion of representatives from different constituencies who are part of the local advisory council. And it does include student voice too, by the way. So we have been blessed with really articulate and well-spoken students who have been at our meetings for the last 2 weeks. So I think that there is, sometimes you have to go fast to be able to go slow, if that makes sense. So we've
Order, come, no. You've done so great so far.
Okay, so this is why the go fast. It is a grant that covers in perpetuity a pot of money to help our kids. In perpetuity. Wait, excuse me.
Order, no. Folks, come on, public comment is over. We're dialoguing here.
Okay, so it is a really unbelievable opportunity that funds will sustain this. When we're looking at the ESSER funds drying up, our student population is declining, just the demographics of the state. Our funding is the cliff. Jim, you've been tutoring me on the cliff. I'm watching it. And we've got good eyes, and Mike in the business office keeping us informed. But the point is that the funding in this district is going to get desperate. And we were very careful not to spend one-time money on sustainable obligations, but the bottom line is that we're going to be in a period of contraction. So it is doing due diligence to look around for grants that can help us with the mental health and associated physical health needs of our students in order to allow them to be successful learners. Now,
folks in the audience, please be respectful of your time. Please be respectful of board members' time here.
That was the motivation, a very unusually unique opportunity for sustainable funds. That doesn't happen very often.
Well, I'm only to one last thing. This wasn't a board-driven strategy, right? We've been talking about other issues that we haven't taken on, right? We have an ELL minority student group who struggles, right? We have a whole group of parents who are not happy with our K-2 student size in our classrooms, would like us to reduce them through K-2. We've had discussions in here about, we have really good growth from K through 5, and we have really good growth 9th through 12th, and something happens in middle school. It just flattens. Why? Where could our students be if we fix that problem? So I would like to spend time focusing on those issues, right? Hell, I'd like to do them all, but we can't. And like Sarah says, this isn't going to be a panacea. We want to go take money because there's money available. And I just don't think from a strategy standpoint, that's what Northville is built on. But I'll leave it at that.
Thank you all. I'll go ahead, Karen. Yep.
I just, I'm trying to gather my thoughts here. I don't necessarily see us as we're taking money because money is available. I mean, there's a lot of focus on the funds, but it's what is happening with them. And I agree with Ms. McIntyre very strongly in that this is another tool. And we need to provide our students with any tool we can. I have struggled, and I commented the last meeting, and I echoed Ms. Prescott's comments with the process of this and how this has come down. And I really respect, Jim, what you and prior boards have done. And coming into this, I mean, I said I wasn't going to call myself new anymore. I'm a sophomore. But, what you've done in the past and following that legacy, it's so important to me. And I just see this as an opportunity that we can utilize to help our kids. I don't think this is going to solve all issues, and it may be a small minority of our students who are or underinsured. Just because they're a small minority, do we not address that? I guess my issue is that, I think we have to take it as a whole for the good of our whole district, and as a whole, I do see more benefits than cons. But I have to say the concerns of the community really weigh on me. I read and I heard a lot of fear regarding services that people believe their children could possibly receive, especially surrounding the minor consent law. I think we really need to make sure that families have all the information on a continuous basis, especially going forward in this window of time. For instance, if they decide to opt in, they need to know that this is for all services and not just one time. And we need to remind them frequently, maybe you sign it once and it's good till you're 21, but I don't think we leave it at that. We make sure that we're communicating on a constant basis. And, specific to the minor consent laws, I've heard, that these laws are the same for every healthcare provider, from a CVS Minute Clinic to an emergency room. However, I don't think we can say that the introduction of these clinics doesn't put that issue front and center. I mean, it does, as we've heard from many comments. And I have to say, as a daughter of retired nurse from Hawthorne Center and the mom of 2 teenagers, I support those laws. They are as old as me for a reason. But putting them in the schools is different than having them at an outside clinic. And we must recognize this concern, and we cannot be dismissive of it. We need to be responsive and communicative, and I think it would be a good idea to have information sessions and other ways to get with parents to discuss this difficult subject. I think we need to do a very clear job of explaining what it is and what it isn't, and then the goal is when students reach out for this type of service. Something that I really pride about with our district and means the world to me is the parental engagement in this district. We do not have the district we have today and all the things we are proud of, from clubs to sports to outside resources. without the involvement of our parents. I just can't stress that enough. And study after study shows how student achievement is directly tied to parent involvement. If we lose that, we are not the Northville that we know. And I cannot I would not vote for something. I sincerely would not vote for something that I believe took away from that relationship. I see this health center as the opposite because it gives families more resources and options to address their children's physical and mental health issues. If they so choose, the idea is not to cut anyone off from their children's health care. It is to provide additional services to help them be met with parents and families and providing the best outcome for kids.
That's your final warning. Final warning. I've heard you 2 or 3 times. We respected your time. Folks, you've been super respectful. That's your last warning, sir. If I need to go into recess, we'll be finding a way to ask you to leave or to have you removed. I've just sat and listened to you 2 or 3 times make comments. I've asked the audience not to do that. For the most part, 99% of you have abided, and I really do appreciate that. Mr. Eloff, final warning there.
I don't really have much more to say. I just really need to make that very clear. I want to make sure that we, going forward, are as communicative as possible, that we are using all outlets, that we are informing on a continuous basis. And, I see that I feel like this could have had a different feeling. Maybe I would have felt differently about this. I'd like to feel more excited about it, frankly, for really way of a lack of a better word. But I just feel like we have to take this opportunity for our students going forward, because we, as Ms. McIntyre said, we need those tools and any tool we can get to help.
And I really hear the concerns in the community about the parental relationship. And I think it's just so important as we all reflect on our relationship with our kids that any healthcare professional that you're currently working with and would work with in the future sees you as an integral part of your child's development. That's not going to be different. That isn't different. Any clinic any healthcare provider who's working in pediatrics and with kids and adolescents knows they're working with a child who maybe they're struggling in a relationship with their parents. And so guess what the goal would be? Let's work on the relationship with your parents. Let's open up those lines of communication and foster that openness on whatever the topic is that might be uncomfortable for the kid or uncomfortable for the parent. That a third party can be so helpful in that. And trusting yourself that you can notice when your kid might need help, and trusting that you don't have to be the one to solve the problems for your child alone, that there is a community of support. And maybe this isn't the resource for you or for your kid, and that's okay. But I think as a board member, I think part of our responsibility is also to care for people that aren't in this room, that didn't come to the board meeting tonight. Maybe they are the family that needs the service. We were in a meeting a couple weeks ago where there was a woman that said, oh my gosh, my kids could benefit from this counseling. I didn't even realize that could be an option. I can't pay for my kids' therapy, and they desperately need it. So I think that I absolutely appreciate all of the public comment. I've taken a lot of notes. I've read a lot of emails. I hear the fear about this dissolving a parental relationship, but I don't see how that could happen. Given the nature of a relationship that you have, your kid comes home every day, hopefully. So I guess I wanted to lean a little bit on that I'm sorry, I'm having a hard time talking with some of the noise, but.
Yeah, folks, please, we're getting to the end of this. I'll have brief comments. Again, no one interrupted you while you had your 3 minutes. You do not have time right now to talk. Please be mindful and respectful. We were all fair with you. Please do the same.
Thank you. I would also like to explore some of the other, thoughts that were brought up regarding cell phone use. That my middle schooler does not have a cell phone, won't have one. So I'm making those decisions myself. Would definitely be interested in hearing more from the community about that topic. I think there are many, many layers of support for our kids and many different things that we can do. I did not grow up in a world where I could look up any piece of information, whether it was accurate or inaccurate, or I would get notifications at any given moment, day or night. I can't imagine what it's like to be a teenager. I have 3 of them in my house, so I have some sense of what it's like, but I'm not living that as a teen. So I just wanted to address, I guess, the parental relationship piece and the family relationship piece that I think any pediatrician or any physician, any social worker who works with kids and adolescents is in this work to foster good relationships with kids and their parents.
All right, I'll close here. First of all, I do want to say thank you to the audience tonight. I know that there are a lot of strong feelings out there across the board and across the spectrum. And in fairness tonight, we have had to be really mindful of our limits, right? But I want to say thank you for the vast majority of tonight. You have been super respectful, and I would just want to say I appreciate that, and I'm sure I speak on behalf of the board and the community when I say that. Some really great comments tonight, last week, and the weeks preceding this. In my mind, I've heard a lot of support for this on one hand and concerns on the other. Support has come from parents, teachers, students, counselors in our district about the need for this. Concerns, I heard last week from parents, and tonight were around, the minor consent laws that folks are talking about, timing, whether there was diligence, whether this is the right tool to address the right problem. And whether we should be devoting any sort of resources to anything outside of just sitting kids in classrooms and educating them. And I've thought about that these last several days and last several weeks. I'll tell you right now, this is a board that has had student mental health and well-being on its mind for at least the 3 years. So Jim, I agree with so much about what you said, but this not being a board-driven strategy, I disagree with. It's what many of us ran on. It's what drove many of us to be here tonight, to be fighting to try to address that. So I think this is really important. A lot of folks understand that as well. I think give me my time, Jim. I didn't interrupt you. I think on balance, the opportunity to provide 7,000 kids and families with an optional service, optional health care, is paramount here. We've seen some things in the last several years, our kids suffering through issues, and you can blame it on masks, or you can blame it on the pressures that kids face these days. I know my kids face a ton of pressure when they're trying to get into schools and thinking about tests and SATs, and I think it's not just masks, and it's not just the state. There's a lot of concerns about what our kids are faced with out there. In terms of should we be pursuing anything outside of paying teachers? Thank God that we have them, paying teachers to teach kids. We spend a lot of time and resources and devote buildings and playgrounds and buses to doing a lot outside of just educating kids. Educating kids, to me, is a wide spectrum of things. We all can agree kids need to eat, right? That's why we provide an option here in our schools. Cafeterias, lunches, breakfasts. We provide kids with playgrounds so they can get fresh air, sports. There's a ton of, 75% of kids, I think, of our students take part in sports. That's not maybe some folks' definition of education, but that's something that we think is very important for our kids and their whole child sort of well-being. So we provide that optional sports for them. I think we can all agree that because of the issues and the harsh realities that are out there that we face around security and safety, we have to devote money and resources to paying armed officers in our schools. No one argues with that. That's not paying teachers. No one argues with the fact that we have to put schools, SROs in our schools, and we've added 2 in the last year. So we have 3 SROs in our schools protecting our kids. What's really scary to me sometimes is that we all are seemingly okay with allowing our kids who are 14, 15, 16, 17, 18 to go out and drive, right? They're out driving on Beck, on 6 Mile, on 7 Mile. Because of the realities around kids driving at those young ages, we provide an option. Buses. We have a bus station. Dozens of buses. I don't know what the number is, but we provide that. Nobody argues with us devoting time, staffing, and resources to buses. So I think that's really important. We do spend a lot of time and resources on things outside of what folks might define as just kind of strict education. In terms of timing and diligence, here's my take on it. I have a ton of trust in our committees, the team. We've already talked about Mike's off and the finance team that we have here and that we've had in place for decades. And hats off to Jim and Lisa and folks who have been treasurer and on those subcommittees in the past. They do a great job assessing the numbers, and I have a ton of trust in them. And I think if this process to me seems fast, it's not because anyone is trying to slip one past the goalie. It's because people on the team see a need. And I heard just about every speaker come to the podium tonight and agree mental health and the well-being of our kids is something that we should be concerned about. I think what drove the timing was an opportunity to take advantage and bring to our community something really important for our kids, and it's a choice. You can opt in, you can opt out. It's a choice. It's an additional service for kids. I think that's really important. And if it looks fast to you, it's because the team saw it, brought it to us as soon as it seemed like it was. This is just my take. I understand folks' concerns about it and the issues that they've raised, but my take on it is that they brought it to us as soon as it was in a form that seemed potentially reasonable and plausible and possible for us. And I think they've done tremendous due diligence. And, I get the questions around due diligence and asking whether we've done enough. We have piles of paperwork and information in front of us. Like I said, I trust the team to do the right thing when it comes to, nailing down the commitments around 31AA funds and what we can and can't use those for. We're going to certainly do that. But this is just an additional choice for kids in 2,000 square feet spaces in 2 of our buildings in the district. I just can't find a way to argue with that. We've been talking about that for years. Everyone agrees that our kids are facing pressures and mental health concerns that are beyond anything that we had to deal with when we were kids, probably. So anything that I can do within reason, I want to do. And that's kind of how I'm coming out. This is another choice for folks to take advantage of or not. Any other comments? Jim, you had a comment.
No, I was just going to say that this was not a board strategy driven, right? At no point, we've been talking about a line item about what's next for this district for a year. Not once did this come up. Now granted, you're right. We want to take advantage of something came up, but this was being worked on before December 5th. And I am disappointed in our team didn't bring it to our board earlier. We could talk about it. This came in as a committee of the whole meeting, hey, here's something we're doing. And it's like, okay. And one of the first comments is, well, we better damn well have community feedback. And, it was done poorly, in my opinion. Anyways, I know where this is going. It is what it is. I think we did a poor job of this. And it's not representative of how we've done things in Northville, and I think the community would have reacted differently had we done this differently, but okay.
I would say, Jim, I think that I have a different perspective. I have a different perspective about the speed of this, because I think that maybe we don't have it under this line item of what is the next big thing, but I think we've floated around different things. I think wellness has definitely been something that we have discussed plenty of different times. I don't think it's in bold on our agenda, but I feel like as a group, this has definitely been top of mind because it's also related to safety and related to student success. It's related to all of the things that we focus on as a board. I think when Darby was brought on to the team, it was very clear in her title, Community Wellness and Partnerships. This was the focus. We were taking our community to the next level of how we address student needs. So I would challenge that. Was there some speed around, like,
I don't want to get into the mud because I'll say some things that I'll regret later. So let's just end it.
Okay.
Because there's some things I'm really disappointed with.
I do have to say that I said this last time, I hear what you're saying, and I do believe that we have talked about the issue in a whole, as we should.
Sure.
It is a concern. However, the timing concerned me because, as I said last week, the issues that have been sticking points have been that were outside of who we decided to partner with or when we applied for the grant. Those are what the sticking points have been. And I just, to be earlier in the process, to be able, because to echo Mr. Mazurek, he did, as soon as we had that, he was like, and we all agreed, I'm not trying to act like but he said, we need to have community involvement ASAP. And the window of time was, very short, and as we all know, over the holidays. So I don't think, for me, that's not enough to not go forward, because I think it's too important to not go forward. To me, I'd like to see this as a learning moment, and when we have other issues to, address. So.
Okay, can I? Sorry, I'm Midwestern in me. To start with an apology. I have to weigh in here, and it's not because, I don't like to get off on what we're here to vote about. In fact, I like to, what are we doing? It's time, people are waiting. But this is really important to me, and it's been important to me. I was the president of this board. I've been on this board the second longest. I've been here longer than most of the Colt staff at this point. And I'm going to say my colleagues across the table here, I agree with them. And I think that because, that this has been defended a couple of different ways, I had prepared some things, I wasn't going to say them, but the stakes of how we do this are actually bigger to me than this decision, which is big. Don't get me wrong. This is, someone said it there in Hillside. I'm not sure, that was a very extremely expensive project, but it's a big to me because we can make objective, independent, fair, good, smart, blah, blah, fancy, good decisions. But if the process looks rotten to people, then we get our good decision, but we lose public confidence. And if we lose public confidence, what we're asking them to do is say, this is just, applying for a grant, and later we'll get all the details right. Or later we'll get them to your satisfaction, or later we'll address some of the things. And so I am very concerned with, Jim says process. I'm concerned with it seeming like a rubber stamp, like I said, or that the fix is in, like I said. And I think the way that we avoid that is that things have to come to this board as a whole, 7 of us. They have to come early and often. I don't care if it's big or small. I don't care if it's just an idea. It's not an excuse to me that it's coming at us fast. It's not an excuse to me that the facts could evolve. It's not an excuse to me that things might fall through and actually not be as good as we thought, or, we spent some time on that. We spend a lot of dang time here, and if I get informed of something and later it turns out not to be a thing, fine. I just think we could avoid all of this meta conversation about process if we talked about stuff. And frankly, I just find it completely frustrating. You can hear it in my voice to hear it said, well, some of us ran on this, and some of us, we've been talking about these things every meeting. Because I just told the whole public about all the things we do for mental health. So to say, we've generically talked about mental health, and then this was just right in there. It wasn't in there. I've sat at this table about tampons for girls that cost $8,000 meeting after meeting, and we had it all out. Okay, so don't tell me that this was talked about. It wasn't talked about. And don't do it again is my message. If you keep doing it again, you're going to lose favorable, thoughtful, calm, reasonable, locked in, paying attention parents and board members. And I'm going to be really disgusted after all the years I put onto this board. And I'm really sorry to lecture everyone and blow my top at it, but I'm really, really invested that this board look transparent and that people leave feeling like, I really am mad at them about that decision, but damn if they didn't cover every dang thing. They do. And that's what we've always done. And please don't tell me that this was talked about. It just wasn't.
All right, any other comments or questions? All right, so I have a motion. It's number 69, properly presented by Ms. McIntyre and supported by Dr. Campbell-Voitel. All those in favor? Aye.
Aye.
Any opposed?
Nay.
Okay. So the motion passes. Thank you so much, folks. That brings us to number 10 on our agenda. Ms. Irving, any added agenda items? All right. That brings us to our second of two opportunities for public comment tonight. I guess we'll, do we have any other cards? All right, so if it's on the top, it's one opportunity per topic.
Okay, did you guys just vote on just the grant and not the Northville High School? Or did you vote on both? What
Both,
happened?
letters of support for both.
So you're giving letters of support for both?
Yes.
Okay. Can am I supposed to do like a card?
No, you don't need to. It's not necessary. We know who you are. Our timekeeper, Andrew, are you ready? Okay, 3 minutes.
3 minutes, okay. So obviously we all agree that the community feels pretty excluded from this conversation, and after being totally excluded from it, and you vote in favor, now you're asking us to trust you. That's really not a good process. I really agree with everything that Sarah just said. Also, you guys say that you did your due diligence, but that didn't reflect in the presentations at all. The information given was so obscure, so confusing. I had to spend an astronomical amount of time this past week to make it make sense. And I feel like I have a pretty good handle on what is happening at this point. And to not be allowed to have an engaging conversation where I can ask you guys questions now that I have the knowledge that I have is so frustrating. I cannot explain the frustration. What was the rush? I get the grant, fine. If you guys want to vote on the grant because you want to move forward with that and then we can still continue to have these discussions, fine. What was the rush on Northville High? You're not under a microscope by Michigan Medicine. Trust me, they want this. They're not going anywhere. I called somebody who works at the Regional Alliance of Healthy Schools over at Michigan Medicine. And for those of you who don't know, that is the program that Michigan Medicine uses that's the program that goes into the schools that runs these clinics. And I asked her a lot of questions. I asked her about the social worker, the one social worker that is supposed to be making all of this difference. And it's not 7,000 people, it's over 9,000. Because remember, it's everybody who lives in the district ages 5 to 21, not just our students. So that's a lot of people, okay? So I asked her a lot about that. What I have found is there's often a big waiting list to get mental health care from the one social worker. I asked her about the virtual option I've heard here and there. Here's the virtual option. They have 2 virtual social workers who attend to everyone in the entire program. That is currently 17 schools. It would be 18 or 19 depending on what happens here. So those 2 people combined 60 hours a week. I think there's a waiting list for them as well. I haven't done the math on that. I don't know how many people are in those 17 schools and the districts that they are in. I have so many questions and I'm so frustrated that I don't get just a little bit more time to be able to engage. Like everything that Sarah said was so true. To move forward without our trust, when our trust has already been a little dinged, that's not how we do things in Northville. And what Jim was saying.
Thank you, Ms. McKindles.
And it was really disappointing.
Any other public comment tonight? Going once, going twice. That closes that opportunity and brings us to number 12. Questions, comments from board members. Does anyone have any?
Sorry, I got upset. I apologize.
It's an important,
My colleagues.
it's important, so.
Hear you.
I have 2 quick things. So, the Marine International Night is this Friday. Friday from 5:30 to 7:30 at Marine. They've done it the last couple years. It's really fun. It's a great opportunity to get into an elementary school. Cool. And then I mentioned it last week, but The collaboration with Northville Youth Network, the Overbooked Book Club, is coming up. Gosh, is it next week already? Next Thursday night. So I've got some serious reading to do now that we have a little bit less reading on our schedule. And that is at Meads Mill at 6:30 in the Media Center. And you do not have to read the book to attend. It'll be good conversation. So
What's it on again?
Screenwise, teaching kids, I can't remember the exact title, teaching kids to thrive in their digital world or something like that. But yeah, that's all I had. Thank you.
Anyone else?
Not right now, because it won't be nice, so we'll leave it.
I'd just like to make a comment in acknowledgement of our last speaker's plea for more information, more opportunities to learn the details. I think that we should try to be responsive as much as we can and get that out, because you're not the only one. Everybody has more questions that need to be answered, and now's the time. And maybe we'll be in a position to have actual participation in that from the ROS people. I mean, that can come personally and speak legitimately about how they run their clinics. But I do think that there's an ongoing communication that, we need to have as a community. So thank you, Karen, for speaking so well about that. I agree.
I guess parent camp, right, is coming up soon, February 3rd. So February 3rd, I think it would be really important if a ROS representative could come and do a breakout session or two. I think that would be essential to hear it from Michigan Medicine ROS staff to understand.
I'm so glad you brought up parent camp. It is so wonderful. So why not start plugging it now? That is a great opportunity. That would be wonderful if we could do that. Yeah.
February 3rd.
All right.
9 o'clock.
All right. Okay.
Yeah, all day. 9 to 2?
Technically, the sessions go from 9 to 12, and then we have the wellness fair that's open. But tonight,
9 to 1?
Then we have the wellness fair is open until 2. So the wellness fair runs the entire time, but the parent sessions start at 9 a.m. in the auditorium.
I just want to say that depth and what we did in that committee of the whole, I just throw so much respect to you all, Dr. Weber, Aaron, and then all of the people that support you in the curriculum pyramid. That was a hell of a lot of things we covered. It was very interesting, innovative, thoughtful, lots of answers, and from grading all the way up. I can't remember the last time I enjoyed a meeting more than the meeting before this one, which we got to dig in on kids and school and grading. So I thought that was really great.
Yeah, super excited about the You Fly.
You Fly. Yeah, thank you for that. And I'd just like to thank the board and community tonight for a different kind of piece to where we could hear each other and learn from each other. I'll also say, before we finish up here, there's a lot of kind of silliness and things like that made about snow days. And yes, I was emailed by 125 kids in the past day. They were all respectful, which was really great. So parents are doing a good job. But I need to say this, I'll say this for me personally. I want your kids in our schools every day. And the fact is, for many of those kids, it's a great place for them to be. And so if you're out there and these 2 days have been an inconvenience for you as parents, please understand that I'd much rather have your kids here. And also tomorrow morning, it's so bad though, they did cancel a ski race tonight, which says something about the weather, because I think skiing is generally done in the cold. So they stopped that. And then tomorrow morning, I would just say we're looking at 15 to 20 degree wind chills. So just be mindful of that if you're out to walk your dog or something like that. So, no, it's going to be something else tomorrow. So be well. Thank you.
All right, let's call us adjourned at 10:40.
You don't want that.